What happens when you give a person with dementia or Alzheimer's disease a virtual reality headset?
I think this is my favorite so far.
Great things. That's exactly what's happening at St. Barnabas's Brain Health Program. A new pilot program at St. Barnabas uses virtual reality to effect positive change in Alzheimer's and dementia patients. St. Barnabas is the first health organization in Pennsylvania to use the Mynd VR virtual reality technology in this revolutionary way. Midge Hobaugh is the St. Barnabas Memory Care Manager, and she says that Alzheimer's and dementia patients who experience virtual reality often have a strong emotional response.
Calmness, happiness, a sense of wonderment, learning, and just a general feeling of, oh wow, that was really interesting, or I really enjoyed that. And if we can get those particular feelings, it's been a good day.
St. Barnabas residents taking part in this virtual reality program can experience a walk on the beach, stroll on the streets of one of the world's great cities, or watch a group of puppies play in a field. The virtual reality experiences were created by a company called Mynd VR. Chris Brickler is co-founder and CEO.
Virtual reality is this new science. It's completely immersive. It's 360. So you're actually in a place or a different time period. Our goal is to provide the most well-rounded sort of stable of content that's senior friendly. We go all over the world, from diving with dolphins to safaris in Africa to traveling around Mars. I mean, it's the content is just limitless in terms of what you can do and where you can take somebody.
World-renowned neurosurgeon Dr. Joseph Maroon is a brain health consultant to St. Barnabas, and during a recent staff training session, he got a chance to put on the goggles and experience virtual reality for himself.
But when you put the headphones on and the goggles, and I was just taking a tour of Yellowstone National Park, which I've always wanted to do, by the way. And I'm looking at bison, I'm looking at the trees, I can almost feel the wind in my face and hear the wind in my ears. So that I was totally focused in walking and hiking through Yellowstone National Park. And as you know, we have a burgeoning number of elderly who are in various types of facilities, nursing homes, nursing care, and also at home. And these individuals are really, particularly in nursing facilities, maybe, in fact, 50% of them do have feelings of isolation, feelings of depression, and also a lot of fear. And there's data now supporting the fact that by this immersive distraction or total immersion in a 360-degree type of virtual reality setting, the distraction is so great that it takes the individual's mind off of the anxiety, off of the fear, off of the depression. And it literally can reset the brain in terms of the focus.
Even though this virtual reality program at St. Barnabas is in its early stages, Dr. Maroon says it's already yielding promising results.
We had a patient here, an elderly lady with significant neurodegenerative disease of the brain, who sat rather in a sullen way. And when she put the goggles on, she was taking a tour through Paris. She walked down the Champs-Élysées, she saw the Louvre, she was able to look at Notre Dame, and her eyes widened. She was able to speak about it. A month later, she still, although rather sedate, recalled those things that many other things drop out.
A lot of times in senior communities, folks lose connection with nature. They lose connection with their families. They lose connection with a lot of things in life, music and art and all these things that are so powerful. Well, we're really seeing this revolution of Mynd VR and what we're doing as a way to bring some of those connecting points back to these folks.
This is the first introduction of this into the state of Pennsylvania for this particular company. So that St. Barnabas is clearly innovative in this role, and at least in Pennsylvania, will be leading the charge.